Dr. Eric Balcavage, and welcome back for Thyroid Success Secret number 8. And today's Thyroid Success Secret, we're going to talk about prolactin. When anybody has hypothyroid symptoms, we definitely talked about autoimmune thyroid being a primary cause, but we want to talk about some other things that can cause somebody to have hypothyroid symptoms. And prolactin is a hormone that can do just that. It can cause you to have an underproduction of TSH and therefore decrease your levels of thyroid hormone that are actually being made. So what would cause you to have a prolactin issue? Well, prolactin is balanced out by two chemicals. One's called dopamine and one's called progesterone. So when these two chemicals are diminished in the body, they're at lower levels, prolactin levels tend to rise. And as prolactin levels tend to rise, it decreases the pituitary gland's ability to make TSH or suppresses its ability to, its production of TSH. TSH, as you remember, is thyroid stimulating hormone, and if you don't have thyroid stimulating hormone being produced at the appropriate levels or the functional or optimal ranges, then you're not going to make as much T4, and the rest of the thyroid cascade is going to suffer, causing you to have hypothyroid symptoms. Now, the tough part about this is if you go to your primary care physician and they run a TSH and your TSH is within that really wide lab range we talked about, probably not going to pick this up. If you use the optimal ranges that we talked about, the narrower range that we use in functional medicine, you're going to be below the functional range. So your TSH is going to be below 1.8, but it's not going to be at that pathologic range around 0.4. It's not going to be that low. It's going to be between 1.8 and 0.4. Doctor's probably not going to pick that up, but a doctor using optimal ranges and using functional medicine is going to say, listen, the TSH is suppressed for some reason, and now we've got to look for underlying causes, and elevations in prolactin levels is one of those things that can create a problem. So how do you know? Well, obviously you can test for prolactin, but there's some other indications that especially for females that may give us a clue. If they have suppressed luteinizing hormone, if they have challenges with their menstrual cycle, or they have infertility, that's a good clue that maybe there's elevations of prolactin levels. Obviously, if you have a prolactinoma, which is a tumor, that can definitely create elevated levels of prolactin, but by far, when somebody has elevated prolactin levels that's creating suppression of the anterior pituitary, we can look at infertility as a great indicator that they may be having have elevated levels. We can also look at their cycle as a potential clue that they may have elevated prolactin levels. So that was Thyroid Success Secret number 8, is looking at and evaluating prolactin levels.